Sorry to hear you're not feeling well. We wanted to give you some helpful tips to help you get through this difficult time. Worried that you may have the virus? We know that right now we are all worried about the coronavirus. The reality is, most people who get the virus are able to stay home and get better without having to come to the hospital or even to their doctor. We wanted to make sure that we all have the same information so that we can get through this together. Should I go to the hospital? Well, here are the symptoms of the virus: difficulty breathing, fever and cough, diarrhea, stomach pain, loss of smell and taste, body aches, and chills. What do I do if I have these symptoms? Well, first, go to your room where you can be by yourself. Drink lots of fluid. Take Motrin and Tylenol to keep your fever down. Get lots of rest. Don't go to the hospital. Please call 667 214 1800. Again, that number is 667 214 1800 if you have any questions. And remember, we're here for you. So when should I go to the hospital? It can be scary to try to figure it out if you should go to the hospital on your own. So we are here to help you. You should call 911 if you're gasping for air and cannot talk, your lips are turning blue, or your face are feeling severe and constant chest pains or pressure, you are feeling dizzy or lightheaded, you're acting confused, you're unconscious or have difficulty waking up, you have slurred speech, you start having a seizure. So how can you protect your family if you're sick? We know you care about your family, and so do we. So how can you protect your family from getting the virus if you have it? Stay home, except if you need medical attention. Separate yourself from other people and pet or pets in your home. Stay in one room. Use a separate bathroom if possible. If you have to leave your home, make sure you wear a mask or a cloth covering your face. 8 things you can do to manage your COVID-19 symptoms at home. Stay home. Monitor your temperature, breathing, and cough. Get rest and drink lots of water. Cover your cough and sneezes with a tissue, then throw it away. Wash your hands often. Stay away from other people. Avoid sharing dishes, towels, and bedding with others. Clean surfaces like counters often. Feeling anxious and stressed? We know you may be feeling very anxious right now. That makes sense. This can seem pretty scary. So what can you do? Try taking a deep breath and count to 4. Hold the breath and count to 7. Then breathe out slowly, counting to 8. Write down your thoughts and feelings. Focus on a place in your body where there's no pain, and use that to calm yourself down when you begin to feel anxious. Do something creative that brings you peace, like drawing, coloring, writing, or creating spoken word. When is it okay to go back to being around people? The great news is that most people get better from the virus at home. They don't even have to go to the hospital. So how do we know when it's okay to be around people again? If you don't have a fever for 72 hours, which is 3 full days without medicine, other symptoms have improved, cough and shortness of breath are better, it has been 7 days since the first symptoms appeared. We truly hope that this information was helpful. We know that this is a frightening time, but the great news is that most people do get better without even going to the hospital. We will get through this, I promise you. I hope you guys feel better soon. Thank you to Heart Smiles LLC. Thank you to Young Elder. Thank you to Ms. Jones and Youth Be More Uprise. Thank you to the Department of Family and Community Medicine, University of Maryland School of Medicine.